Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County. And today we'll do another one of our COVID conversations. But as COVID slows down, we want to do more than just COVID. So we're now calling this COVID Conversations and More. And the and more today is joining us is Dr. Kelly, who's one of the resident physicians at AVIVA. And she's going to be talking to us a little bit about mortality and then a really exciting project that she's doing up in the northern part of our county. But as we always do, we answer questions that people have, and we got a few good questions this week. If you do have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get to them in the next session. And as always, we start at the world level, move down to the country level, the state level, and then the local level to tell you how things are going. Well, the good news is things are going very well. In the world, we're actually seeing a slight increase in the number of cases because there are places that did not have a lot of disease before that are now starting to see cases. So South Korea, which has had a very low number of cases during much of the pandemic, are now starting to see lots of cases. And China, which had almost no cases for many months at a time, are now seeing cases. In both of those areas, the Omicron variant, and you'll remember the Omicron variant doesn't respond quite as well to the vaccine as the previous variants. And the concern is that the Chinese vaccine especially does not work particularly well against Omicron. So we're starting to see increased number of cases there. We're also seeing a high number of cases in Australia and New Zealand, again, places that didn't have much disease before. But the good news is that Africa, South America, and North America are seeing really a decreased number of cases. And that's good news. Europe is a bit confusing. There are places in Europe that are going down, but then other places that are going up. So we look very carefully at the United Kingdom and England because in each of the past waves, they predicted what would happen in the US 6 or 8 weeks later. So when they had a big alpha wave, 6 or 8 weeks later, we had it. When they had a big delta wave, 6 or 8 weeks later, we had it. When they had big Omicron, 6 or 8 weeks later, we got it. And now what they're seeing is they're seeing another spike from the other form of Omicron, which is called the BA2 variant, and they're seeing a little spike. Well, this little spike is little, and it's not resulting in a lot of hospitalization deaths, so that's good news. So there could be another little spike in the rest of the world, but at least it doesn't seem to be associated with lots of hospitalizations or deaths. In the US, we're having really a quickly declining number of cases. 48 of the 50 states are having a declining number of cases, which is great. We're watching carefully that some of the places that had Omicron early, like New York and Puerto Rico, are starting to see a slight increase, but nowhere near what we saw with any of the previous peaks. The other 48 states are stable or going down. And in the US right now, there's not very much disease, except in parts of Alaska, parts of Kentucky, the panhandle of Texas, and in Idaho. Oregon is very quiet. There's almost no place in Oregon that's having lots of disease, and Douglas County is very quiet. We're down now to about 6 cases a day, which is the lowest number we've had since May of 2021, so almost 10 months ago since we've had this low number. We have a relatively low number of people in the hospital, but that number is not zero. So we now have, this morning had about 17 people in the hospital, only 6 new cases, but 17 people in the hospital. This is suggesting that older people who are getting this disease are really getting quite sick. And what we're seeing overwhelmingly is that the people who are in the hospital are people who are not up to date on their vaccine. So when we look in the day, for example, there'll be 17 people in the hospital, only 1 is up to date on their vaccines. The other 16 are not up to date on their vaccines. Given that most of our senior population is up to date on the vaccine, it shows that the vaccines are really very effective at preventing hospitalizations and deaths. So if you've not had any vaccines, please go ahead and get it. Almost all the clinics in town have plenty of vaccine. And if you've gotten your first or second shot and need a booster or need another dose, please go ahead and get it because it really does provide good protection. The other good news is that there are 3 oral medications that you can use for COVID. So the 2 that are available, the ones that are available here are molnupiravir and Paxlovid, which is a combination of 2 oral medications. And those medications, if you take at the onset of the illness, you get diagnosed with the disease, you take these pills, both of these are twice a day for 5 days, they reduce your hospitalizations anywhere from 30 to 90%, which is really a pretty good deal. They're easy to take, just oral medications. In addition, we have an injectable medicine called sotrovimab, and we have plenty of doses of that at the hospital. That's a little more complicated because it's an IV, but it's again 80 or 90% effective in preventing you from being hospitalized or dying. So at this point in the pandemic, we're still going to see some cases. And if you are positive and are in one of the higher risk groups, you really should think about getting one of these antiviral meds. Questions we came up this week is, what about flu? Well, as restrictions have relaxed, we are starting to see more cases of flu. What was really remarkable is that last year, when we did distancing and masks and whatever, we had almost no influenza in the last flu season. In this current flu season, we're starting to see a few more cases, and actually we've got a few hospitalizations from flu, but in general, still a very low number. Again, the flu vaccine for this year is not well matched to the virus, so vaccine's not going to provide that much help, but almost all of the flu viruses that are out there are sensitive to another antiviral drug called Tamiflu. So again, if you are sick and got diagnosed with COVID, please use either the Paxlovid, the Molnupiravir, or the sotrovimab. And if you're sick and get tested positive for flu, really Tamiflu can really help you get over this quicker and decrease your risk for hospitalization. So that's the current status here. One of the questions we'd had was, are there any new variants on the horizon? So we're very, very, very carefully looking for variants, because variants really could change the whole game here. So if you remember, before the Omicron variant came out around Thanksgiving time, we were looking at being near the end of this, and then that came and really upset the apple cart. And so a new variant could come out and do that. So we're looking very carefully, and we're just not finding these new variants. And that is good news. The way we're looking for variants is that a certain percentage of the positive tests are being sequenced. With a low number of cases now, that's a high percentage. And we're looking to see if these are variants. We're seeing very little. In Oregon, it's almost all Omicron. There's a little bit of BA2, but it's pretty much all Omicron. And the other way we do it is we look at wastewater. So wastewater, the sewage water. So when you have COVID, you tend to excrete this stuff in your stool, and it gets into the wastewater, and then you can test in the wastewater to see what's happening. In Oregon, we're not finding variants that way, and we're finding a decreasing amount of RNA from these viruses. So right now, everything looks good. Our best advice at this point is we can relax some of the restrictions, but still be careful if you're sick. Because if you're sick with flu or if you're sick with COVID, you really don't want to be spreading it to others. And if you are sick, please get tested for both flu and COVID. And if you are positive and are at high risk, consider getting one of the viral medicines for that to decrease your risk of hospitalization and death. And sadly, we continue to have deaths. And again, these deaths tend to be older people, but they tend to be people who are unvaccinated and not up to date. So please, 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 if you're not up to date on your vaccines, please go ahead and do it. You can do it at many of the pharmacies. You can do it at AVIVA Health Clinic, which is open each weekday to go ahead and give COVID vaccines. And that's a great segue to Dr. Kelly, who's one of our resident physicians at AVIVA. And she's been deeply involved in all kinds of other public health projects. So welcome to the presentation.
Hi, thanks for having me. So excited.
So tell us, in addition to being resident and all the work that entails, the other things that you're working on.
Yeah, so my experience with COVID actually started in Southern California, outside of Los Angeles, where I was doing general surgery training. And I learned quite a bit about how deeply a community can be impacted by just a virus, or what seems to be just a virus. And so that was a catalyst to the next 3 years of discovery into how this pandemic really affected our ways of life, our economy, and I questioned what the risk factors were for people who really got severe infections and who died. And so when I joined the Roseburg Family Medicine Residency Program, I started a study with Stanford University, which looked at the COVID-19 mortality, which means people who died from COVID, risk factors. What was it about our county that was hit so hard? We were recognized on a national level for the degree that COVID had an impact on the folks of Douglas County. And these people are some of my favorite people in Roseburg and Yoncalla and Drain and Oakland. So I wanted to know, what was it that was killing them? What was it? And we really discovered three things. There were three factors that influenced people's mortality. And I'm presenting this data at next month's OAFP conference in Bend. And those three factors were being unvaccinated, the male sex, and being overweight or obese, like your body mass index. And those three factors determined whether or not people in our county lived or died. And from there, I explored, well, what do people know about that? Like, how healthy do people in Roseburg think they are? So with Blue Zones, I did help coordinate a real age assessment with ShareCare and Boston University that was a health assessment of the city to really ask people how healthy they thought they were and have their real age determined based off of publicly available data sets, lab work, measurements of their height and weight. And what we really found was that, again, obesity was the factor that was causing people to be sick. And not only that, but people did not want to know. People didn't want to know what was causing them to be sick. And there was fear. And within that, I noticed a potential for education. And with knowledge, knowledge brings power. And what I sensed was that people had no idea what really meant whether they would live or die. And so that was a lot of my COVID research. And then it propelled me into my most fun project that I've been able to start here, which is called Yoncalla Grassroots, which is a 501c3 nonprofit up in Yoncalla, just a exit right above Drain, and a beautiful community of hardworking people in Douglas County who are otherwise very isolated from healthcare, especially with the $5 a gallon gas prices now. People up there get stranded, and having them come back and forth for nutrition appointments and to manage their diabetes for a lot of folks isn't realistic. And I think that reflects some of why our county was so sick before COVID even hit, why we had these risk factors. And so I started going to after school meetings at Yoncalla Elementary, and one of the ladies asked me if I had any tips for how to prevent her from needing shots for her diabetes, and that's insulin, when essentially the pancreas fails in diabetes. And I thought that was an amazing question, an amazing idea, and a great catalyst for a grassroots effort to propel the community forward from within their own ideas. They just needed some help and some resources, and somebody to guide. But all of their ideas were coming from within. So we started Yoncalla Grassroots, and that pretty much sums up the last year of what I've been doing.
Well, tell me a little bit more about this Yoncalla Grassroots. I have a deep love for that little community that has seen hard times in the last decade or so. So tell me what that group is going to be doing.
Yeah, so we actually had our first sort of unofficial small meeting last week, and the group is focused on a couple things. The first is overall wellness. So that includes nutrition, exercise, and community building too. And so those are our three main focuses. It is steered by the members of Yoncalla. I'm just there as a group member. I live in Oakland, Oregon, as a group member to just help the conversation steer and to bring some science into it, since I have a background in studying metabolism in college. And so the group is basically where we meet. We spend the first 30 minutes just having a healthy, usually plant strong dinner together that also has animal products in it. And hopefully we will be able to source those from local meat sources and local dairy sources, which Yoncalla is rich in. And so we'll spend that first 30 minutes with community building. and just catching up with each other. I think all of our meetings start that way anyways, whether we like it or not. And we're all really hungry for connection and to build just to build some relationships and see each other, especially without our masks on. It's so exciting. And then the next hour is where we either cook something or we talk about a disease process. So next week, we're going to talk about diabetes and some ways that we can use food to manage diabetes and prevent needing shots like insulin. And one of our group members brought up a really good idea. She wanted to talk about her two ideas were couscous and fresh herbs for the first group. So now I'm thinking creatively about how I can include that in the discussion, because it's what they want to do, not what I think they want to do. So I'm so excited to see where this goes and be a part of this group, because it's not my group. It's really the people of Yoncalla's group. And I am so lucky to be a part of it.
Well, I think they're lucky to have you, and so this will be a great project, because we recognize in medicine that we take care of a lot of people after they already have diabetes or lung cancer,
Mm-hmm.
and we can certainly help them, but it would be so much better if we could prevent them from developing the diabetes or prevent them from needing to be on insulin. And that's really got to be the goal. So when we talk about public health, we talk about working upstream. And what you're doing is a perfect example of working really upstream. So thank you so much.
Yeah,
we'll have to have you back. We'll have to have you back in a few months so you can give us progress on how your group is going.
Yeah, that would be great. It is a 3-month project, 3-month pilot project. So we'll be ending around summer solstice with a solstice celebration. So I could report back after our final meeting.
Well, that would be great. So again, thank you for joining us. Again, the word on COVID is pretty good. Right now, there's not a lot of worry about other variants, but there still is some COVID disease out there. Still a bunch of people in the hospital, still far too many, and still vaccines work. So if you're not up to date, please get up to date on your vaccines. Again, this is Dr. Bob Dannenhoffer. I was joined today by Dr. Kelly, one of the resident physicians from AVIVA, and we'll do this again next week. Thank you.